According to the National Breast Cancer Foundation, 1 in 8 women in the United States will develop breast cancer in their lifetime. What are the best treatments for that disease? Joining us to discuss the options are for those available, those undergoing treatment is Dr. Grace Makari-Judson, the Interim Vice President and Medical Director at Bay State Cancer. Doctor, thank you for joining us today.
My pleasure, David.
So what are some of the new advancements in the treatment of breast cancer?
There are new advances in every area, in every aspect of treatment. In surgery, there's more precise surgery with better cosmetic outcomes. For radiation, there are new technologies to limit exposures to surrounding normal tissue. And in medical oncology, we have welcomed many new drugs. Now, we've had new chemotherapy drugs and new hormone treatments, but now our treatments options have expanded to include a category of drugs called targeted treatments, for example, for cancers that are HER2 overexpressing. We also use immunotherapy in triple-negative breast cancers. And what's very exciting is we have a new category of drugs called antibody-drug conjugates that treat specific subsets of breast cancer with less toxicity than chemotherapy.
To hear, are there new technologies that aid in breast cancer treatments that would also help improve the patient outcomes?
Some of the new technologies have to do with molecular testing of the tumor. We're trying to really learn more about what makes the cancer respond to one treatment and perhaps be resistant to another. And in particular, we've been using molecular testing to determine who will benefit the most from chemotherapy and what individuals can we spare from chemotherapy and treat with hormone medicine alone.
Now, is neoadjuvant chemotherapy helpful in the treatment of breast cancer? What do we know about that so far?
Now, most people will have surgery first, and then we determine what extra or adjuvant treatments may be beneficial. For many patients, though, there may be a significant benefit to getting chemotherapy up front. That's what we call neoadjuvant treatment. This can help to reduce the tumor size and allow for less extensive surgery, but importantly, it lets us as the medical oncologists assess the response to these medicines, to personalize the treatment, and to make the best recommendations after surgery. The time of strategy, this type of strategy is really important, and it's very complex to really do well. Thankfully, we have a highly functioning team to coordinate this type of care, and in fact, we're in the process of publishing our experience at Bay State.
All right, now time for the million-dollar question. Are we getting closer to a cure?
You know, the chances of an individual surviving breast cancer have increased significantly over the past 30 years. It's partly due to screening mammography, partly due to better surgery, better radiation, and better medications. So I think that, we're moving in the right direction, and our treatments are more and more effective each year.
All right, Dr. Makari-Judson, thank you so much for joining us. We appreciate the time.
Thank you.